I've rang them.
You can't speak to the station. They're out on jobs. You need to go through the control centre to organise an ambulance.
Saturday the 5th of February 2022. The time is 6:50 p.m. Daylight saving, it's light now. I'm going to call Blacktown Ambulance about an issue, see if I can get some assistance from them. Call 731 2167. Sounds like they're having dinner. Okay, I'll call them back now. Open 24 hours. Okay, we'll try again. This is Blacktown Ambulance Superstation. Well, they hide their phone number. Nowhere else. But they don't want to answer the phone. That's not a good start. I've got this phone number here, aussiebiz.com, so it may be incorrect phone number. It's got one Google review here. We'll just read that. Gives them 5-star. Paul Hind, 5-star 2 years ago. I'll give it one more try. And unfortunately, I'll have to ring the emergency 000, but I'll give it another shot. Few minutes to 6, we've got the Seiko musical melodies clock playing some music. Sorry about that if it's annoying someone. Perhaps that's the wrong phone number.
Emergency 000. If you require information in relation to COVID-19, please visit healthdirect.gov.au or call the National Coronavirus Helpline on 1-800-02-0080. If you require emergency assistance from police, fire or ambulance, please stay on the line.
Emergency, police, fire or ambulance?
Ambulance, please.
Ambulance, what state and town is the emergency in?
New South Wales, Wentworthville 2145.
Wentworthville in New South Wales, connecting ambulance.
Thank you very much.
Ambulance emergency, what town or suburb?
Wentworthville 2145. I'd like to speak to the Blacktown ambulance station. I've rang them.
Oh, you can't speak to the station. They're out on jobs. You need to go through the control centre to organise an ambulance if that's what you're after.
Well, I've rang a number there, Blacktown Super Ambulance Station, 10 Bungarraby Road, Blacktown, number 4731 2167. I've rung it 3 times and nobody's answering the phone there.
Because they're out working, sir.
Yeah, but they can't all be. I want to speak to the station supervisor. Because
they're all out busy. Do you need an ambulance?
How can you say they're all... Well, who am I speaking to? What's your name?
The control centre.
Yeah, but what's your first name?
It's Steph.
Steph. Look, there's people there, the supervisors, and there's a big place. I need to speak to one of those.
What's the inquiry regarding?
Look, it's long and detailed, but it's an emergency. And could you ask one of the supervisors from Blacktown to phone me?
No, unfortunately, that's not how it works, sir.
Well, how does it work, Steph?
They all need to come through the control centre. We can't put you through to the station. It's not how it works. They're all out on jobs. They all come through the control centre. We triage the phone call, and then the dispatcher in your local area will issue the job out to the ambulance, and the ambulance is generally out on the road at the time.
The problem is the local area ambulance station here is North Mead. And
so if there's an emergency, we are delaying help, so we need to get a job into the system. What is the address?
The emergency is I've had it since, for a few days now. My GP, Dr. Peter Wong, rang me.
Hi, my name's Bianca. I'm the supervisor. What's the address that you're at so we can send the car to you?
I don't want an ambulance, and I don't want anyone from Westmead, Bianca. I want someone from Blacktown.
We can't guarantee where the ambulance.
No, it has to be because I've had.
We can't do that. All we can do is organise an ambulance, and then the closest available ambulance.
Now, all I need is just one of the supervisors, someone who's got a bit of knowledge and is a bit civilised with social graces. Someone to come here in a car and take my blood oxygen. That's all.
What's your name?
The doctor suggested, Dr. Wong suggested to me, look, he was very concerned, and I told him about the. No, listen. Can you please listen to what I'm saying so you get the full picture? He said
I've been listening for nearly 10 minutes, but we haven't.
Well, look, I'll just finish it off. He said, well, you can. Yeah, hello.
G'day, mate. My name's Glenn. How are you? I'm one of the paramedics. How are you, mate?
G'day, Glenn. Look, I've been ringing up.
Yeah, listen, I've been listening on the other line.
Yeah.
You want your oxygen saturations taken, don't you?
Well, I just want to have a look, and I got something on my back because the last time the ambulance came here, they basically kidnapped me and took me to Westmead Public Hospital, and I was shackled for 4 hours. And another ambulance officer, Myra from Westmead, she come into the house and started abusing me and the carer.
Oh, okay. Well, that's.
And I want someone friendly to come here. And as far as
We'll send someone out who's friendly, who's compliant with you, and get on with you.
Well, someone who's civilised.
My turn, George. It's my turn.
Okay, yeah. As long as I get my turn.
Yeah, my turn. What we'll do, we'll send someone out. I think you want your oxygen saturations level taken. They can do that. They can assess you, and then from there we can see whether or not you need to go to hospital because of your haemoglobin.
Listen, Glenn, you're not listening. There's no way in the world that I need to go to hospital. Hang on, no, just listening, please.
I'm listening.
Please listen. For me to go to Westmead Public Hospital, I was abused, shackled, and tortured there. Okay, and I'm not making this up. This is what happened. I was abused and shackled and tortured for 4 days. On another occasion, there, I was abused there in the emergency ward by the emergency. What do they call it? The consultant, Dr. Mi Ling. She pulled the full drip out of my arm and threw me out. On another occasion at Westmead Hospital, they dehydrated me there, Dr. Kelvin Lowe, and I've complained to the Western Sydney Local Health District Board, Graham Loy, the General Manager, Rebecca Tyson. That place is a death factory. I don't want to go anywhere near that. All I want...
You don't have to go down there.
Yeah, but the last time my carers phoned the ambulance here because I wasn't sleeping well, they come and physically, not physically, they took me against the will from my home, from my house, and not only that, Glenn, they called in the police riot squad out the front, and the medical report, they falsely claimed that I've punched a paramedic, and that's why.
All right.
And
so briefly, you just want an ambulance to come out, right? Not to take you to hospital.
No. Look, mate, there's no way I'll go to any hospital.
No, that's fine.
Any hospital ever again. And I'd recommend anyone. This is a shambles, a complete shambles. It's like a food.
You want the ambulance tonight out to you.
Well, look, someone, not an ambulance, just one person. You know, like they've got the little car, paramedic car.
Oh yeah. Maybe.
And not to make the ambulance come with the bells ringing and the bloody sirens ringing. It's embarrassing me in the street. The whole street saw me strapped down to the bed the last time the ambulance came here, the whole street, and they saw the police riot squad that come into the house with guns, and they used the police as an excuse to section me, because you know it's just terrible. And I've complained to all these people, and there's no way in the world. You know, I've got cancer in both lungs. I've got stage. Have you got that on your system?
We'll have a look for it. Well, look, I've got to go.
and look, I know you got. I've got to go too. But the thing.
All right. We'll finish up and we'll get someone out to you.
Can they call first?
Oh, I don't know, mate, whether they can call first.
Well, would it be very long, Glenn?
Look, I don't know because I'm not up in the Sydney area. I'm down the coast where the call centre is in Wollongong.
Yeah.
So,
well, listen, Glenn, don't send anyone here from, or stipulate from Northmead Ambulance Station. The people from Blacktown Ambulance Station there, if I could speak to the supervisor there, they came out here before. They're very good.
We've made a note to give you a ring if there's time. If there's time to give you a call before they turn up. How's that sound?
Oh, they can make time, mate.
Yeah. All right,
everyone's busy. Hey, Glenn, everyone's busy, not just the ambulance people, mate. We're all busy, and busy's not a good excuse, mate.
Yeah. All right, mate. We'll take care, eh?
All right, Glenn, and thanks very much for your help. And and Bianca there, I know you guys are, you know, it's a bit. You got a tough.
Bianca, thank you too. Yeah.
I got a tough job, and you got a tough job. But the thing is, this situation, what's happened with me, could affect you or Bianca,
I know.
Anyone's family.
We don't know what's going to happen in our lives.
No,
I've got to move on to the next call.
You've got some rotten eggs in the basket, mate.
Oh, sorry. Okay. Well,
okay. Cheers, Glenn.
Cheers. Take care, mate.
Yeah. Okay. You too, mate. Cheers.